So if you've ever dreamed of maybe researching portable MRI at Massachusetts General Hospital in Boston, or collaborating on new treatments for Parkinson's disease at Johns Hopkins University in Baltimore, maybe you've thought of completing one of the top Master of Public Health programs in the world at the Harvard T.H. Chan School in Boston, or Columbia University in New York, or maybe University of California, Berkeley. Really, wherever your dream study or research destination may be, a Fulbright Scholarship could be your ticket there. Our program facilitates some of the most transformative research and educational experiences available anywhere in the world. We've offered funding for Australian citizens to undertake master's degrees, PhD research, postdoctoral or short-term collaborative research programs in the United States for over 75 years now. So before we go into the nuts and bolts of the program, I'll just talk a little bit about our history on the next slide. So broadly speaking, the aim of the Fulbright program is to enhance bilateral relations between Australia and the United States. But behind that broad remit is a really fascinating origin story. The program was established in 1946 by a US Senator, Senator J. William Fulbright, who had this incredible idea to essentially turn swords into plowshares. So following the Second World War, Senator Fulbright, he saw the destruction that happened during the war and resolved that he would do everything possible to never see that happen again. His idea was to use the sale of surplus war armaments sitting around the world after the war to fund programs of educational and research exchange between the United States and allied countries. So essentially, funding productive exchanges, through the destructive power and negativity of war. He as a Rhodes Scholar, Fulbright truly believed in the power of global educational exchange to mitigate communication issues between countries. He really believed that investments in international education rather than ammunition were the best pathway to peace. And thus he created the program. And since the Fulbright program was established in 1946, it's grown to become the largest bilateral exchange program in the world, now operating between the United States and over 150 different countries. The Australian program began in 1949, so last year was our 75th anniversary. And in that 75-year history, we have funded close to 6,000 Australians and Americans to undertake these exchanges. So I'm telling you this not just because it's a really interesting story, but because if you watch this presentation and you're interested in applying for a Fulbright, it's the selection committees for Fulbright really like to see an understanding and appreciation of the history and values of the Fulbright program, so that so I'd recommend doing a little bit of research into the history and values and really understanding, why we've awarded these scholarships for over 75 years, and imbuing that into your own application. So as mentioned, we're joined by three fantastic Fulbright scholars today. I'll just give you a brief introduction. We've got Dr. Joshua Kovoor, our 2025 Fulbright South Australia Scholar. We've got Dr. Britt Suann, our 2024 Fulbright Western Australian Scholar. And we've got Associate Professor Stephen Bacchi, one of our 2024 Fulbright Future Scholars. So they're all incredibly impressive individuals, and I won't do them justice by giving you their full bios. So I'll just hand over to Dr. Josh Kovoor to give a little bit more information about what he's doing in the United States via Fulbright. Thanks, Josh.
Yeah, so pretty much my research is going to be at Cedars-Sinai Medical Center, which is located in Beverly Hills in Los Angeles in the US. It's under the Dr. Andrew Hung lab, which is a sort of a world-leading lab that does research in AI and robotic surgery. I'll talk a bit more detail about that a bit later, but I'm really grateful for the opportunity.
Thanks so much, Josh. Now let's hear from Dr. Britt Suann.
Hello, my name is Britt. It's a pleasure to be here. Thanks for inviting me. I'm doing a master's degree here, so I'm in Boston at the moment, halfway through my Master of Public Health. I'm in the health policy cohort, but I'm also doing a concentration in child protection. Yeah, as I said, I'm halfway through, so there's lots to talk about, but I'll pass on to Stephen for now.
Thanks so
Hi,
much,
everyone.
Britt.
I'm Stephen. I'm doing research at the Massachusetts General Hospital and Harvard Medical School. And I imagine that everyone's in the middle of a shift at the moment because it's during the day. So we're going to try and be relatively sharp about our slides here and let you ask some questions at the end. Because I think that, we're kind of case studies or case reports, as it were, and you can kind of look at our stories and see how it transposes to your life. So this is the kind of general background section with some points highlighted specifically for clinicians. And this is the Harvard Medical School, which is a relatively impressive building. So why apply? I think that, Alex has already told you all about the history, but this is an international exchange. This is you going to the USA to study or conduct research or both. And clearly this is going to be good for your career. I don't need to tell you that. And clearly this is going to be good for meeting lots of interesting, wonderful people all from around Australia and the United States. And the Fulbright's not just about the name. There's some really tangible benefits that make this sort of work possible that wouldn't be possible otherwise. So clearly there is a financial component, which is very helpful. But I'll let you read the long list of benefits there yourself. The thing that I found most helpful, to be honest, is the wonderful Fulbright team. So for example, Tamara is one of the postdoctoral supporters, and I would not have got to the US without her support. The visas and all those processes they take work. And Fulbright is there with you every step of the way. And I would not have been able to do it without that sort of support. And I think if all of your clinicians like me, admin is one of those things that if there's any support available, we will gratefully receive it. Now, there's a few options in terms of what you can apply for. So I'm going to go through just a couple of select ones I think is going to be most relevant to our audience. So if you've done a PhD, then you're in that postdoctoral category, like Josh and myself. If you've not done a PhD, then you're going to be in that postgraduate category. If there are professors listening or distinguished chair category people listening, probably don't listen to me, probably ask someone else. But we'll go more into that postgraduate category now, because I think that'll probably be most people. So in that postgraduate category, this is where you can go to the US to do a master's degree for 1 or 2 years. So this is like what Britt's doing. Or if you are enrolled in an Australian PhD, you can go to the US to do part of it. And I think this is probably one that's going to be relevant to a lot of people who are in advanced training or early consultants. You can also theoretically go for your entire PhD, but fitting that in with training may take some thought, which we'll talk more about afterwards. Now, these are the categories. There is also kind of an extra part you can apply for, which is the Fulbright Future Scholarships. And really, they work very well for people in health fields. So it's just like an extra part of your application you can include. And I would recommend doing it. So in terms of eligibility and selection, Australian citizens, you have to have an undergraduate degree. So, does that exclude medical students? Not necessarily. Like if you're a postgrad med student, you've got an undergrad degree. You could still be a candidate, or an MD degree where you've got an undergrad. And then the selection criteria, it's going to be looking for a well-rounded person who's going to do well overseas and represent Australia well. Now, this sort of application process is clearly highly competitive. In some ways, it's similar to a lot of your job applications, or AT applications. So you'll need a CV, you need referees, you can have an interview. You're also going to need a project proposal, which is different. Then in some places, you'll need a letter of invitation from your institution. So having a really solid contact in the US for some of us, particularly if you're one of the postdocs, is vitally important. And then those Fulbright Future ones have a few extra components as well. Now, planning your timeline is where we get more relevant to clinicians again, because this takes planning ahead. So I think a worked example made this clearer for me. So theoretically, now I don't have the concrete dates for this year, so this is theoretical, don't hold me to it. Applications are opening very soon, say in the next month. Say you do your applications, you get them submitted by July this year. Say you have an interview in October this year, find out your results and say December this year, your placement will probably not start until August the following year. So this takes planning. This takes planning around your job and planning around your training. Because then you're over there for 4 to 8 months or so, and you come back and you have to have a job on the other side of it. Now, the Fulbright website is excellent, great source of information, really the place to start. But there's also some specific clinician considerations that we'll go through now. Now, I couldn't let you escape without my holiday pictures. So while you're in the US, watch out for American sport. So we've got NFL, baseball, F1 in Vegas. That was from the Bellagio, great fountains. Basketball, everyone takes up some sort of distance running for some reason. Don't let it hold you back. I'm no good at it. Winter sports, building snowmen. And also, Americans are fantastic people and they like embroidering things. So prepare for having your name on an item of clothing, or at least the brand of the institution you're attending. But serious considerations. So a question that often arises is, can I do clinical work on a Fulbright? And the answer is no, quite clearly. There's a document that you need to sign on Fulbright that says you will not be doing clinical work. I mean, there's pros and cons to that. So the next question is, do I need the United States medical licensing exam? And if you're not doing clinical work, the answer is no. You can go and do study, you can go and do research. If it's not clinical, you don't need the USMLE. Yeah, I've done the USMLEs. They weren't bad exams. They have some quite interesting questions, but you do it for a different reason. I mean, they're reasonably expensive to sit too. Now, I think a really important one is, can this be accredited? And the answer is yes, with a qualifier. So it's going to depend on your training program, and it is really important to sort this out ahead of time. So this means corresponding with your relevant college and asking them, because sometimes you might be taking the path less well traveled to do this. Sometimes there may not be too much precedent, and you want to be clear about this, because if you're going to go and do a 8-month placement, if you can get that accredited, you want it to be accredited. You're doing really interesting, important work for Australia, and your training should be recognised. Now, this is competitive. So people might ask, how much research or how senior do I have to be competitive? And it's really variable. So there are people who will apply with over 100 papers. There'll be people who are applying who have 1 paper. These people can all have very successful Fulbright experiences, and I wouldn't let your stage of research hold you back. Similarly, there are people who are, senior professors who will be applying, and people who could be PGY 1 or 2. You are all potential Fulbrighters who could really contribute. And really the way it fits in with training is different for everyone. And I think that's what we'll talk about now. So we've all done this at different stages in our training. I'll hand it over to Britt first to talk about how it's fitted in with her career so far. And then Josh and I will have a chat about it too.
Yeah, thanks, Stephen. I'm going to be talking to the earlier career end. So I was PGY 2 when I left Australia, and I kind of knew that I wanted to be studying a Master of Public Health super early on after my internship, so PGY 1. So I'm definitely one of those people who didn't think that I was qualified enough to do it. I just really wanted to, and I thought I'd put my hat in the ring because I'd regret it if I didn't try. So if you're thinking, I'm not sure if I'm qualified enough, just look at me and think, okay, if Britt can do it, then I might be able to too. So yes, I knew by the end of intern year that I wanted to study a Master of Public Health, and then I started looking at international options. And sorry, it was earlier. It was the moment I graduated in medical school, because I applied for Fulbright in my PGY 1. That's right. And so I applied in July before the due date, just before. I think the interviews were around September, and then I found out about it in November of my intern year. And then you have to start applying for the universities. So I wanted to apply for a Master of Public Health, and I just put in a list. I wanted Harvard University first, and I put 3 other universities after that, and Fulbright helped me do that. To apply for the university, it wasn't that difficult because Fulbright helped so much. They helped with the visa, they helped with like the programs, and the only additional thing I had to do was an entrance exam that I chose to do. It was optional for Harvard at the time. You should double check it. It's called the GRE. So I did do that in December. And then I found out about Harvard being successful by end of January, early February, and was getting packed and ready to go for my semester to start in August of 2024. Everything like, it sounds like a really drawn out time, but everything does happen really fast when it happens, and it's really hard to plan in the future for something that you don't know that you have yet. That's just to say, I found it very easy to just go to my hospital and say, I have this opportunity, I'd love to go. If you consider having my job for me when I get back, that would be awesome. And if not, thank you so much. And that all worked out for me. So I'll be able to go back to my job when I finish here in May. My degree is only 1 year long, which to me is like a little bit sad because I'm really genuinely loving it. You should all consider doing it, especially an MPH, where like global health and having an understanding of different people, cultures, backgrounds is so important. I think it goes well with an international exchange. But yeah, I'm happy to answer any questions at all. I'm just going to check. One of the questions in the chat was, how were each of you able to find contact letters for an invitation in the US for a postgraduate degree? You didn't need to do that. Yeah, I can answer other questions later. I'm just aware of the time.
Cool. So my name's Josh. Just to give you a bit of background about me, is that I'm about to start my PGY4 year. And I think the perspective that, the benefit that I provide from my perspective is that I'm currently in the process of applying for accredited general surgery training. And I think my situation is relevant for all of the clinicians in Australia who are in the process or planning their application for accredited training. So to give a bit of my background, about midway through medical school, I sort of found the interest, and my passion lies in the field of general surgery. And so it's always been a dream of mine to become a general surgeon. And then a secondary interest of mine, apart from being a clinician, is in research, specifically in AI and healthcare systems research. And more recently, I found a true passion in rural healthcare systems research as well. So to give a bit of my timeline, is that concurrent to my final year of medical school at the University of Adelaide, I started my PhD. I did that concurrent to my final year of med school and my intern year, which is in Central Adelaide. And then in 2023, I took a full year out to do my PhD full time. I then got awarded it last year in 2024, which was when I was doing a rural surgical year in Ballarat in regional Victoria. The reason I bring up that timeline is that when you're even towards the end of your PhD, you are eligible to apply for a postdoctoral Fulbright scholarship. And all you need for that is a letter or some sort of proof or evidence that your PhD will be awarded by the time that you actually commence your research or your postdoctoral fellowship, which will be in August the following year. So as we said, there like goes into this a lot of planning that's required. The Fulbright Fellowship is something that I only came across over the last few years. And the reason that I actually pursued it as opposed to other prestigious scholarships was that this is the one that's best for our clinical career progression. What I mean by that is that the US years or the calendar years start in August and go until July the following year. And in Australia, obviously, it starts in February and goes until January the following year. What that means is that particularly once you get to an unaccredited registrar level, is that the Australian year is split into 2 6-month blocks of February to July and then August to January. That works perfectly for doing a Fulbright postdoctoral fellowship, which you can do under a 6-month period. What that means is that you can apply for your accredited program the following year, and then in that meantime, as you're away next calendar year to start, you can actually do your full entire postdoctoral fellowship in that 6-month period, which is what I'm doing. So my research is going to be in AI and robotic surgery, and I'm doing a 4-month postdoctoral fellowship at Cedars-Sinai Medical Center in Beverly Hills, which is the minimum you can do for a postdoctoral fellowship. I think you can go up to 9 or 10 months, so under a year, which is what Stephen is doing, which he'll tell you a bit more about. But I think for the process of applying for accredited training, this aligns perfectly. I did have to do a lot of planning in advance though. So I actually traveled to the US a bit earlier this year, earlier in 2024 to meet with my group physically in person and to gain a lot of that strong collaboration at the very start, and then started planning some really impactful research for my time, mainly because I'm going to be there for like a short period of time so that we can have the most impact possible there and then have an enduring collaboration that lasts into the future. I'm happy to go into more details in the question time, but that's generally a synopsis of basically at the stage of applying for accredited training.
All right. And I guess I'm the oldest one. So I'm PGY, I have to sit down and count 7, heading towards 8. It's frightening. So I did my PhD concurrently with BPT. And then I was in my 2nd year of advanced training on a cover shift. And the cover shift was going pretty well, to be honest. Not much was happening. And I suddenly realized I had no plans for my non-core year. And I didn't really know what a non-core year was. So then I started making plans. And that's when I realized that neurology advanced training will accredit a full-time research year. And then it was looking at where I'd like to do that. And I thought Harvard sounded like a good place to go. So then the Fulbright process happened, as Britt and Josh have described very well. And for me, this started in the middle of 2024. So the first half of 2024, I was doing my non-core year full-time research in the Northern Adelaide Local Health Network, so locally. So you can actually have your accredited time kind of split between almost rotations, sort of, where if it doesn't sync up completely properly, you can do kind of segments of which the Fulbright could be a component. So I guess the really kind of important part for me was making sure that it would be accredited. And I liaised with the college ahead of time, and it was the path less well traveled, but they were very supportive and was able to get clear communication in advance of that. So I'd highly recommend it as well. So we'll let you ask some questions, but in terms of next steps, if you are really looking at this keenly, so the way I would do it is look at your training pathways, what you want to do, and then communicate with the college or hospital if relevant. Think about higher degrees by research. So this could be going overseas to do a master's, or say starting a PhD in Australia, then going overseas. And that means you're going to need supervisors for that more often than not. So you're going to need to communicate with them. Then you're going to need to get your site in the USA sorted out. And that means you might need to sort out that contact in the US, as Josh spoke about, going overseas and making those interpersonal connections. And then you can really start locking down the Fulbright application itself with your CV, referees, think about the interview and your proposal and relevant documents. But more so than anything else, if you forget everything that we've said, speaking on behalf of the others, it's reach out to Fulbright, reach out to Fulbrighters. You know, we've all really enjoyed this. I think I've developed personally and professionally, and we would absolutely love to help you. So just reach out via email, LinkedIn, whatever, and we'll help however we can. And I think we've probably got some questions now.
Yep, that same goes for us at the commission too. We love hearing from people who are applying. There's no such thing as a silly question. So more than happy to field any questions, and we'll start by now. So Fabiola, I answered a few in the chat. I'll just go back over them in case they were missed. But Fabiola asked, she's an Austrian clinician working in Australia. She wants to know, is there any way past the citizenship rule? Unfortunately, not in terms of the Australian program. We can only offer scholarships to Australian citizens. However, the program operates in about 160 different countries around the world. So I've just sent the Fulbright Austria link to Fabiola. But if you're from if your home country is not Australia, do a bit of Googling. I'm sure there'll be a commission in your country through which you can apply. Someone else asked if for the postdoc scholarship, does the 5-year period post PhD apply to the time of application or the time of placement? And it would be the application time, but also there are some exceptions to that rule if you've had career interruptions or things like that. If it's been 10 years since your PhD, then the scholar category would be a better category for you to apply in rather than the postdoctoral. Jesse wanted to know if the person is currently enrolled in a PhD, but by the time of the commencement date, they've submitted their PhD, would you apply as a postdoctoral or postgrad? I think, yeah, Josh covered that. Yeah, you'd apply as a postdoc if you submitted your PhD by the time your program would commence, and all we need is a letter that from your supervisor, for example, that states that you're on track to have your PhD conferred by the time your program would begin. The website doesn't list the full PhD in the US as an option in the postgrad category. That's because the full PhD program is only available for those who've applied for the Fulbright Future Scholarship in the postgraduate category. So basically the Fulbright Future Scholarship is an award that is available in all of the categories. You just have to tick a box on the checklist and you'll be considered for that award along with the general category awards. You also need to provide a 1-page impact statement that talks about how your research or study can improve the lives, livelihoods, health, well-being of Australia and Australians. That program covers covers full tuition for masters or PhD students, and yet you can undertake a full 5-year PhD in the US via that particular program with all the tuition expenses covered. So it's an extremely well-funded scholarship. So a couple more. A few questions have come in. Okay, so I'll hand these over to the panel. So Britt mentioned about letters of invitation to the US. For a master's program, you do not need a letter of invitation. However, if you're applying for a postgraduate visiting student researcher, so if you're applying to go over to do part of your PhD in the US, you will need a letter of invitation from a proposed host institution. Or if you're applying in the postdoc or scholar categories, you do need letters of invitation. So I'll hand over to either Stephen or Josh to talk about how they secured those letters of invitation.
I can answer this because I did it more recently. My opinion on this is that the Fulbright Scholarship Program is an extremely prestigious program. So when going for or trying to figure out which lab or which group you should collaborate with, you should aim for one of the world leads in whatever your field is. So a big component of my PhD research was AI in surgery. And through that, I learned a lot about the different types of AI and also read through a lot of the literature and particularly a lot of the world-leading literature. So this group in Cedars-Sinai Medical Center in Beverly Hills, which is under the Andrew Hung lab, which is mainly a robotic surgery and AI lab. Through my end of my PhD, I read a lot of their work, particularly in the benefits of AI for surgical training and also surgical outcome prediction. So pretty much after I had established that this was a group I'd be interested in learning from and collaborating with in the future, I just simply reached out to them. And I knew that I had a trip to the USA actually planned for other reasons earlier in the year for that I was planning to apply for. So during that time, I made the effort, rearranged a lot of things to prioritize physically meeting Dr. Hung and also looking at the actual site that we propose to set this up in the future. I think there is benefit of doing that in person if you're able to do it, because it secures a stronger relationship, which is mainly the thing that you want. Obviously, it has to be something that you're interested in. And I think doubling down on something that's part of your PhD is a strength. But of course, if you have a new interest outside of your PhD, it's also perfectly fine. The benefit of the Fulbright program being so prestigious is that even the top groups in the US and the world are keen and interested in collaborating with you through the Fulbright program, because it also has benefits for their research and their international collaborations as well. So after you establish that connection, either through in-person or virtual or simply email correspondence, you simply need to be open with your interests and your goals from the fellowship program. And then also sort of just say, this is what I need from a letter of invitation, and sort of discuss that process as we go. Of course, there are a lot of specifics of what you'll be doing during your time, and that is mainly worked out with your group, and it's what your group is comfortable with. So I would have goals for during the time, and also with regards to the international collaboration that you have planned after. So for example, for mine, we have like a lot of things that I'll be learning about in the field of AI and robotic surgery, and the group's research during that fellowship period. But then I'll be supervising a PhD student, which is essentially implementing a lot of their AI work in an Australian centre. And the PhD students' goals is mainly to develop these systems for a different type of surgery, laparoscopic surgery. So I would recommend having similar goals and similar approaches when approaching your US center for your Fulbright.
Great answer. How about you, Stephen? Do you have any thoughts on? I think Fulbright. We've had quite a few Fulbright scholars at MGH, so there's a pretty strong relationship between, I think, the Australian medical research community and MGH. But I'd love to hear your thoughts on how you went about getting that letter of invitation.
Yeah, spot on, Alex. So mine was a lot more based on existing relationships. So acknowledging that if you can, going overseas ahead of time would be great. It's not always possible with rosters and leave and relievers or no relievers. So sometimes it will be via email and Zoom. And that's where having an established connection is invaluable, because, you know, people are busy. Cold emails sometimes go through the keeper. But if you know someone who knows someone, then it really makes the pathway work a lot better, because, you know, it's a referral you can trust, so to speak. And I was fortunate to know several people who had been to MGH previously and essentially worked through pathways of people who knew each other. And it's been absolutely wonderful. And I think that's where, again, if you do know people who have gone to the center that you would like to go to, you know, working with them, reaching out to them and learning more about it through them is a really good place to start.
Absolutely. But that's not to say that you can't be the trailblazing conduit for a collaborative relationship between your institution and a US institution. I think I definitely agree. It's easier if you can get a referral, because then you're not just cold emailing. But American researchers seem to love getting cold emails, particularly if you have done your own research, you know what they're doing, you demonstrate enthusiasm for the work you're doing, and you put forward your own work and say, hey, this is what I'm keen to do to collab with you on. Chances are you'll get a reply at the very least. Don't be afraid to drop the Fulbright name in the email too, because it's an extremely well recognized program in the United States. And if you say, you know, I'm applying for Fulbright, I'm looking at doing this, interested in your research, you know, that magic combination could get you a really interesting, or could be a spark to a really interesting conversation that could lead you to a letter of invitation. And really, all it requires on their end is to, you know, on institutional letterhead, right? Yep, we're willing to host this person for 4 months, or for 6 months, for 8 months. and that's really all that needs to be added to your application.
Yeah, and if I could just jump in quickly, I think more so than the method that you reach out to these people, so the most common and easiest ways is either via email or LinkedIn, in my opinion. But I think the thing that has more association with your success from forming this relationship is doing your background work ahead of time. So when I went, I had read this research lab's work back to front. I knew a lot of the work that they were doing, had some of my own ideas of potential projects or potential things that we could possibly do. Of course, I hadn't developed them, but I went in knowing a lot of the details ahead of time. And I think then you're actually primed for a proper discussion that is more likely to result in a reality, rather than just saying, I'm interested in doing a fellowship without having looked at anything, which is also like fine. If you can actually get a successful Fulbright scholarship experience just doing that and then leaving it to the group to see what they're comfortable with. But my opinion is that do your background work, go in, make it a more efficient experience for them, and something that you can fit in a lot more seamlessly as well.
Yeah, absolutely. And so there are a couple of sort of related questions that I might just quickly tackle out of order. Jesse wanted to know if you need to know the specifics of what you'll research during your Fulbright scholarship period, if awarded, or can the specifics be sorted further down the track? So as mentioned, when you're reaching out, you don't necessarily need to know the exact project. You could, as Josh said, you could suggest a few different possibilities during your application, because you need that letter of invitation, and because you need to really, quite specifically note the method and the potential outcomes in your application. You definitely need to have a really concrete idea of what you'll be doing at the time of application. If you're doing research, but if you're going down Britt's path, if you're doing a master's degree, you don't necessarily need to know all the details. You don't even need to know the exact institution that you'll be studying at, because at the time of application, you won't necessarily have been accepted into that program. So you can mention a couple of different programs, but you don't need to know the specifics. So how might you recommend approaching US contacts? So are there any other ways that anyone, you could give them a call, or that the time zones, or you have to stay up a bit late to get in touch? I think email is probably the best method of getting in touch to begin, or LinkedIn, as Josh mentioned. Yeah, if there are any other platforms that researchers or clinicians use that I'm not aware of, that they might be, like there might be some kind of secret doctor's Twitter or something. I'm not sure, but
I think sorry. I just want to say ResearchGate is another one. But sorry, Britt, you go.
No, this is slightly on a different note, but I have found LinkedIn incredibly useful. I never really thought of it as a helpful tool as a doctor, but if you're considering kind of those creative careers in medicine that aren't just clinical medicine, whether that be public health, international development, humanitarian aid, politics, health policy, so much of it is happening on LinkedIn, and you can follow people's career paths and see what type of opportunities they've done, whether it is domestic or abroad. So I highly recommend having a little look on there as well.
Yeah, absolutely. So how do you know which university or institution, doesn't necessarily have to be university, will be best placed as an appropriate site? Is there information relating to this? I think, it's been talked about already, but I think Google's going to be your best friend, looking up who's doing the world leading research in your particular field, which lab is working on, if you're doing something really niche or esoteric, like which lab is leading the way, or doing something interesting, or doing something that you feel that you could make a contribution to. That's another thing about Fulbright, is it's very two-way. It's not just about what you can gain from the US, it's also what you can provide. So that's a good way to think about it when writing your application. Feel free to jump in if there's anything else that you guys want to mention about that. So here's a really good question though. this person's enrolled in an Australian PhD, planning to apply for a postgraduate degree. Is there anything on your CV or reference letters or any other component of the application that you believe made yours stand out or maybe gave you an edge over other applications? I'll get all three of your answers on this. Britt, what do you reckon?
Oh, that's such a hard answer. Question to answer. I think what made me stand out was this idea that I wanted to do something beyond clinical med, and I had a really strong driven vision, and I had that was within my project statement. And then when I got the interview, that was also in the interview. I think they want to see a strong personal voice, that you're staying true to yourself. You're not just making things up for the sake of trying to get into the program. And they want to see that you hold true to that throughout the whole process. So as much as possible, I know it sounds hard, but trying to stay true to what you like and writing that as eloquently as you can in the application should hopefully get you a bit closer to the line.
That's such a good answer. Absolutely agree. I think genuine, and authentic are two real key words that I would apply to every successful application. Don't just think about, what do these people want to hear or want to read. Stay true to what you want to achieve, what you want to contribute, and what you want to bring back, and that will give you the strongest possible application. Stephen, what do you reckon? What made yours stand out?
I think it was my winning personality. No, but seriously, I had fairly tangible plans. I think that was probably one of the more unique aspects of my application, possibly. I had very clear plans about things I want to contribute to the US and also bring back to Australia. I plan on executing those fully. So it wasn't purely theoretical. I mean, there's certainly an important role for basic science and esoteric theory, but I had some very tangible plans that I wanted to deliver, and I plan on doing so.
Yep, absolutely. I definitely think your project statement is, you really have to be quite specific. If you're doing research, really be specific about what you want to achieve, and like I said, what you want to contribute, what you want to bring back. I think they're really good things to keep in mind when you're writing. Josh, how about you?
Yeah, I think particularly as both other speakers mentioned, I think particularly if you're going for the Fulbright Future category, which is the scholarship that I've gotten, like Stephen has gotten as well, you need to demonstrate that you're doing something that's true to your personal ambitions, and that is also something that's striving to benefit Australian and US societies overall. And I think that's something that you have to really tease out to show that you have real plans, that you're serious about these real plans through your research to translate to benefiting both societies internationally. So I'll give mine as an example. Through this Fulbright Scholarship, I'll be working with one of the lead groups in AI and robotic surgery. The main translations of that research is one, benefits of objectivity and increase tracking of progress in accredited surgical training, which we propose and we will plan towards working towards integrating into Australian training to benefit surgery across the nation. Then also in outcome prediction after surgery as well. So this will benefit the patient population as well, regardless of where surgery is being conducted. Then to sort of answer the other part of the question as well, on your CV, I think the Fulbright Commission really likes to see that you've done things that an ambassador for Australia would have done. So in my background, in addition to my research, I've tried to sort of be an advocate for benefiting collaborative research as well. So I've started a couple of collaboratives at places I've gone, mainly to empower medical students and junior doctors in getting started in research as well. Also, I've tried to publicize a lot of our research findings as well, and as a result have been involved in media publicization of our research as well. So I think the Fulbright Commission, it doesn't have to be those things specifically, but they really like it if you've gone above and beyond or done something to sort of bring out your personal advocacy and personal research as well, that will show long-term benefit for Australian and US societies.
So a really interesting question. If someone's asking if there have been any successful applicants or previously US citizens but have let go of their citizenship and have not lived in the US since childhood, that's asking about that citizenship rule, because of course you can't be a US citizen and apply for a Fulbright scholarship in Australia. You can apply in the US to visit other countries, but you can't go the other way. So I think if you've like officially relinquished, I don't know if that's the right term, if you're no longer a US citizen officially, then you can apply. But if you are still a US citizen, then just the way the program is set up, it's set up via a bilateral treaty. So the wording of that treaty is that it's for Australian citizens to visit the United States, Americans to visit Australia. So as long as you've officially relinquished your citizenship, you can still apply. So any chance that undertaking post-grad med school might be considered a research career interruption? If that's so that you can apply in the postdoc category, I think the career interruptions are more related to like personal circumstances rather than sort of different aspects of your career. But the 5-year rule is a little bit, it's not super strict. So if you're just 6 months shy or something, then just reach out to us by email and we can discuss how that might work or alternative pathways. You mentioned, this is a really good one. You mentioned ambassadorial skills as a selection criterion. Could you please give some examples of this that are relevant to clinicians? So ambassadorial skills is a really tricky one. It can mean different things to different people. So let's hear from each of the panelists. Britt, what do you think ambassadorial skills are, and how do you think you addressed them, both during your application and the interview?
Mm-hmm. It's a really good question. I actually think as clinicians, we're really well placed to answer this question, because if you think about ambassadorial skills, in my head, I think about communication, negotiation, respect, equity. And those are all things that I think we all hold dear and make us good doctors. So there's a lot of case examples within clinical medicine that would work here. In terms of my interview, I remember getting a question, how would you manage if someone had preconceived ideas about Australians, or vice versa? How would you kind of manage that situation? I think that's another great question that it relates to ambassadorial skills. And it's something maybe you guys can think about in your heads, because I know that as an Australian, I had preconceived ideas about what America was going to be like that I can say now aren't necessarily true. And when I'm here, people have very funny opinions about Australians. Sometimes they love Australians, so don't worry. But the scary animals and all of these different ideas that aren't necessarily true as well. So I guess that transcultural communication and getting over biases is also a really good skill to have.
Yep. Great answer. Totally agree. How about you, Stephen? What are your thoughts on ambassadorial skills?
I think that the way I frame it is around like concrete examples. Like when I was a medical student, I did an overseas rotation in Montreal in neurology. And when I went over there, I went and brought some of the educational approaches that we were using in Australia. They were integrated into their course with some asynchronous learning content. And then over there, they were doing a lot of script concordance test question research. So then returned to Australia and conducted some primary research projects around the types of educational approaches they were using. So I think that, in embodying some of the learning approaches we were using and contributing to that cultural exchange, I served as an ambassador in that role. And I think trying to emulate that in future and build upon it is how I'd approach an ambassadorial role, and still am.
Yep, excellent. Josh, how about you? What are your thoughts
Yeah.
on ambassadorial skills?
Yeah, I think a simple way to think about this is like the formal positions of like an Australian ambassador or US ambassador. Think about what sort of qualities they need in their roles. So the things that I think about, as Britt mentioned before, is like this excellent communication, particularly on the public stage. And so you need to be an advocate for not only Australian society, but you need to be an advocate for international collaboration. And you need to be a serious advocate for a cause, in my opinion. Something that I think in my background that I think was a good thing in that exemplified my ambassadorial skills was that I've previously been an advocate or tried to set up collaborative research through actually going through and setting up formal research initiatives. Also recently, and this is something that I talked about a lot in my application and interview, is that I'm a true believer and strong advocate for rural healthcare work and rural healthcare research to benefit populations in rural Australia as well. So this is something I've undertaken via setting up a research collaborative in Ballarat and plan to seriously be involved in after my Fulbright fellowship is completed as well. So I think things that you can do at an initial stage to benefit or exemplify your ambassadorial skills are simply things that make your research or your cause more public. So that means talking about your research, particularly in public settings. So public speaking about it. The easiest one to do is in local forums or conferences, particularly at local, national, or international stages. Then also trying to publish broader, so in both refereed or like peer-reviewed publication avenues and also non-refereed things as well. You can also advocate through the written word through that. Posting about your research on LinkedIn. So bringing it to the broader community. And then also, if you have opportunities to do it, being involved in media coverage of your academic work as well, which is something that myself and Stephen have and currently are involved in quite regularly. Those are sort of the ways that I think about exemplifying your ambassadorial skills. But of course, it works in a variety of ways for each individual. I think the main thing is about actually standing behind a cause that you believe in and want to advocate for that will benefit Australian and US societies.
And Vegemite and Tim Tams.
Yeah, absolutely. Well said. And that's a really good point, is that it doesn't necessarily have to be something in your professional life. It can be, you could be advocating for your local swim team or for, I don't know, your daughter's school carnival or something. Like there are various examples of ambassadorial skills that are both within and outside of your professional sphere, and it'll be different for everyone, but I'm sure everyone listening here has something that they're really passionate about and want to advocate for on the public stage.
I'll just mention,
yeah, go ahead.
Very briefly to that. A lot of people have said that I'm the first Australian they've ever met. So I think when they're asking this question, it's are you going to represent Australia? It's very real because some people haven't met Australians.
Absolutely. Those skills, they do, they do come in handy, and people are chosen to be Fulbright scholars for very particular reasons related to those ambassadorial skills. So, definitely consider how, why you're being asked that question and how you might apply those skills in a US setting. So are we proposing an area of study, an existing area of study, or do we tap into a new area of study, or do we tap into an existing area of study currently being undertaken? It can be either. You can be thinking of doing something novel, or you can be heading over to learn from something and contribute to something that's currently ongoing. The main thing that you want to think about is the selection committees are going to be asking themselves the question, why does this project have to be done in the US? Why is the US the best destination for this person? Can this research be just as easily conducted in Australia? And you have to answer that question in your application. So how likely are you to get chosen if if an American institution is willing to adopt you for 4 to 8 months? A lot more likely than you probably think. This isn't like a sort of 0.2% success rate, ARC grant kind of situation with Fulbright. Like we get a lot fewer applications than you probably think, and quite a large proportion of bona fide applications become successful Fulbright scholars. So it's significant. So are you able to apply for a postdoc if you've previously completed a prestigious postgrad scholarship like Rhodes or Monash, Gates, etc.? Yes, absolutely. Yeah, it's almost, you can definitely include that in your application. You just can't have you can't have a Rhodes or a Monash and a Fulbright at the same time. You can't have a scholarship that covers the exact same expenses. So there was a question also in the chat about the Frank Knox fellowship that Britt is on, and because that scholarship covers different things to what the Fulbright scholarship covers, it's fine. But because the Monash the expenses would be you'd be doubling up on funding. That's the only thing that's not allowed. So there was one question for Josh, just about anything in particular when you first reached out to your group that you mentioned or discussed that helped develop that initial rapport and get you that invitation.
Yeah, I think, like I said, the easiest way is to do your background homework, not only on the field that you're proposing the research in, but also on the group itself. I think the easiest way to do this is through Google Scholar, where you actually go through and read their most recent work, particularly over the last couple of years. And then through Google more generally, go to the lab's official pages, go to the lab leads official pages, actually look at what their work has been over the last few years and what their future goals are. Because a lot of these websites will actually say what their future goals are as well. So I'm not saying that you have to just jump in and do exactly that type of work, but it primes the discussion that you're going to have with them. So my approach is that, yeah, I came with some ideas for what I would do during the time, but then it's really a discussion that is bilateral and bidirectional with the research crew and particularly the lab lead as well. So I would say come with your own ideas, but be open to do whatever their research goals are as well, and leave it open as well, because you might find that the research, even if it's different to what you initially planned, it could actually be something you end up being more interested in and also being far more impactful for your field and Australian society as well, which is the more important thing. But I would do your work ahead of time and then come in primed for that discussion. I think that's the easiest way to get success from this.
Yep, absolutely. Great advice. So do you need to be published in a paper in order to apply? No, you don't have to have any kind of publications history. I think if you do have publications history, you can definitely add that to your application, but there's nothing in the rules that says you have to have published in order to apply or be successful. So no. And last, interruptions to an internship to do a Fulbright a problem with the home hospital. So that might be, what do you guys think? Do you think you could interrupt an internship to undertake a Fulbright?
It's definitely, I think, a question for APRA and PMC, because I know it's changed. So I got through my internship completely. I was doing the 1-year internship. I know it's changed to 2 now. So I had finished it completely, so I'm not affected by that. But it's something I keep in the back of my mind, because I know the rules are a little bit sticky sometimes, and I'm constantly thinking about my registration. The other thing I want to really quickly note, if someone does want to do an MPH specifically, is that the RACP, if you want to be a public health physician, needs you to send your degree and all of the units that you've done for eligibility for it to be approved in Australia. And there are some times where people have to do extra units in Australia after having done a degree in the US or abroad, anywhere, if they feel like it hasn't quite matched up with what they expect of Australians. It's just something to note.
Yep, really good point. Well, look, thank you so much. We've gone over time, but just some really, really fantastic questions there. So I just wanted to make sure we got through them. Big thanks to Dr. Britt Suann, Dr. Stephen Bacchi, and Dr. Joshua Kovoor for staying a bit longer to answer those questions and for helping facilitate this session. If you have any further questions, our panelists' emails are just there. You could reach out to us at fulbright@fulbright.org.au. If you want to recap any of this info, as mentioned, we'll be sending this recording out to your email following the session. But again, just wanted to thank you all for joining. It's been great to speak to hear your questions, and it's been fantastic to hear the insights from our Fulbright scholars. Big thanks. Enjoy the rest of your afternoon or evening if you're abroad, and yeah, we'll see you next time. Thank you.
Thank you very much.
Yeah, thanks for having us.